rainy fall day. Finally it's fall. I'm excited about that. So today we have a really great panel of speakers that are here to share expertise, talk about lead. So of course, lead in the water is something that with the Flint water crisis it's been at the top of the news, #1 headline for many, many months, years now, sadly, here in Michigan. But today we're going to focus on really what the main driver for lead poisoning and lead exposure is in Detroit, and that's lead paint in our homes, and it's also soil, lead in our soil. So we'll hear from, again, a panel of experts on things that we should be concerned about with lead, some places to get some answers, and then also what's happening here in the city as well as in the state of Michigan in general to deal with lead exposure and making sure that we remediate this very important problem. So as Carrie mentioned, I direct our Transnational Environmental Law Clinic at Wayne State University Law School. And in addition to that, I also co-direct our Community Outreach and Engagement Corps with Dr. Peter Lichtenberg. And so we're very excited to welcome you here today. Thank you for coming out on this rainy day. And with that, we're just going to get right into our program. So what I will do is I'll allow each of our speakers to just briefly introduce themselves in the interest of time. So we'll first hear from Dr. Abdul El-Sayed, who's the Executive Director and Health Officer for the City of Detroit Health Department. Then we'll hear from Dr. Doug Rudin, and Doug's a researcher at the Cures Center at Wayne State University, and he'll talk about Lead 101, what you need to know. And then we'll hear from Mary Sue Schottenfels from the Clear Corps in Detroit, and she'll talk all about resources and ways to find solutions when you do actually have lead in your home. So, without further ado, please join me in welcoming Dr. Abdul El-Sayed. Thank you.
I always have the unfortunate circumstance of speaking after Nick and then having to adjust for not being 6'5". Thank you again for having me. It's an honor and privilege to be here. I want to talk a little bit about what the city's perspective on lead has been over the last year or so. First, I want to share why it is that we're so concerned about the lead challenge as a city, where we see our role being, and how we're playing that role. And then I want to talk about some of the specifics. And then lastly, to get us thinking about what the future of lead ought to be. If you've ever heard me speak, it's the bad habit of having been a former professor where you always start with definitions. And so I really want to define a couple of terms for us. And those terms are public health and environmental justice. Public health is what we as a society do collectively to assure conditions within which people can be healthy. What we as a society do collectively to assure conditions within which people can be healthy. And I want to focus on 4 aspects of that definition that I think are really important to keep in the back of our minds as we think about what a public health department ought to be doing around a challenge like lead. So the first is we as a society collectively. It's what we do together. It's about what groups of people that represent the community and government and industry and the nonprofit sector, how they come together to do a couple of things. What are those? That is about shaping context, what we as a society do collectively to ensure conditions. What is the space, the neighborhood, the community within which we are all experiencing a certain thing? And what is that? Well, that's about how populations, right, we as a society collectively do to assure conditions within which people can be healthy. So who are those people? It's all of us. It's about what we do to shape the kinds of conditions within which all of us are experiencing health. And in particular, it's about asking how those places, how those communities, how those neighborhoods, how those environments are changing the health of the people who live there. And that ties naturally into the second definition, which is environmental justice. Environmental justice is about the decision-making process about places. So I just told you public health is about places where people live and where people experience health. Environmental justice is about the process of making decisions about those places and the effects of those decisions on the people who make those decisions. And so an environmentally just society is a society where all of us together get a say about how we use our places and that those places don't have a disproportionate impact on any one group in society. All of us have a say, and all of us get treated equitably by the places within which we live. It's about governance of place, okay? So as a health department, we take our responsibility very seriously regarding how it is that we engage place as a moment of public health, and the fact that as government, if in a democratic society, we believe that it is our responsibility to reflect the whole. That if we are a democratic society, a society within which we choose our leaders, then we have a responsibility to the full community, not just certain parts of the community. And herein is where we come to this question of lead. Lead being a heavy metal that is found in a number of different places that Nick talked about, whether it is in the paints that we used to use, or the soils into which many of those paints leaked over a long period of time, or the water into which the pipes leached this heavy metal. And we know that this heavy metal has serious health consequences that don't just affect a child or an adult acutely, in particular a child, but they have implications for the way that that child develops and the ways that very critical components of that child's body are going to develop. And so lead is a public health issue. Lead is an environmental justice issue. At the health department, the work that we've been doing has really centered on a couple of things. First, how is it that you eliminate lead in the environment? Because at the end of the day, we often focus on lead after the fact, right? We focus on lead after a child has already tested elevated, or we focus on lead after there's already been some sort of crisis where a number of children have been exposed. But we fail to recognize that actually the fact that lead is in the environment means that that exposure risk is always there. And so our first goal has been to how do you eliminate lead in the environment? One project that we undertook starting in about April of last year was to make sure that our children were safe in the one place where we concentrate them for most of the day, most of the year, which are the schools. And we had been doing some work with the schools, recognizing that many of our schools, unfortunately, given the socioeconomic reality of our school districts and our city, many of our schools hadn't had the kind of upkeep that we would all want for those structures that house our most vulnerable people. And so we had been inspecting at the same time as hearing about all of the challenges that had come in terms of lead in water in Flint. And so what we did is we embarked on a process by which we had every single school in the city of Detroit, all 360 buildings where children attend school or Head Start or daycare, test their water for elevated lead. How do we do this? Well, we had a really generous grant from the Children's Hospital of Michigan Foundation, and we created a protocol that mixed the best of the EPA's protocol and the best of the MDEQ's protocol. We put them together, and then we created a template. And we said, if you test your school, you take a sample from 3 really high-flow outlets in the school. If you do this, we will reimburse you the cost of testing. And then what we'll do is we'll create a website where you can, your findings will be up there. So if your levels are acceptable, then that's fantastic. And if they're not, then we'll create a mitigation plan, and we'll post it up so families know what the situation with lead in the school is. It took us 5 months, but we got every single school, all 360 schools to be a part of this. You can go to www.detroitmi.gov/ I think it's school water. It's linked on the health website, which is detroitmi.gov/health. And you can see every single school building and what the results of the testing was and what their mitigation efforts have been. So that's number one. The second question is, if you look at where the health department had been late 2000s and really to 2015, we've had a number of issues. One of the really terrible decisions that was made by previous administrations was in effect to privatize the health department. So in 2012, during bankruptcy, rather than think about how you fund the health department in different ways, et cetera, it was just privatized. It was turned into a nonprofit. And nonprofits, unfortunately, are incentivized very differently than government. Because if government is in effect a representative of the people we serve and accountable to the people we serve via a democratic process, nonprofits are not. Nonprofits are accountable to funders who fund them. Screening for lead, given where we were thinking about lead, was not something that the nonprofit wanted to continue to do. So the city of Detroit, nor nonprofits, performed any lead tests between 2011 and 2015. None at all. And if you look at the rate of lead testing in the city, it was down to about 40% in 2015. So 40% of young children who are eligible for a lead test were getting them. That's down from about 75% before the health department was privatized. So we saw that we really needed to do a much better job ascertaining those kids who may have lead in their blood, but who are not picking up because they're not getting tested. So we started doing lead tests as a matter of course for anybody who came to our clinics for either WIC services or immunization services. So every child who comes will be offered a lead test. Our lead testing numbers have gone up, and we found that between April and June, we did about 50% more lead tests in the city of Detroit than we had the year prior. Part of that is because there's better information, and much of that is because we're doing it in our clinics. Now, I want you guys to think about this. If you are lead testing children who otherwise don't have a pediatrician and therefore wouldn't get tested, are their rates going to be higher or lower than the average? Higher, right? These are kids who don't have access to a pediatrician. And for all the reasons they don't have access to a pediatrician, they also are more likely to be exposed to lead. And so what we found is that between April and June, there was a slight uptick in the number of lead cases. And in my conversations with our compatriots at the State Health Department, they said, well, this is terrible, there's more lead in Detroit. I said, no, there's not more lead in Detroit, there's more lead that you know about, which means that these are kids that we can take care of. And the third and final thing that we've done in the course of this year has been to create a coalition across all of the city agencies and nonprofits that directly touch the lead issue. And so that organization, that coalition called Lead Safe Detroit, we meet every month. And what we've started to do is to case manage every single case of elevated blood lead in the city. And what we're doing is saying, rather than leave it to chance as to whether or not we offered a family an opportunity to have their housing abated or we offered them an opportunity to have their water tested, we are making sure that every kid with elevated blood lead has access to everything that the city has to offer. So every month we meet for 2 hours in a remarkably hot room, and we case manage every single case. That this child is an X-year-old child who was tested at pediatrician's office or was tested at the health department, had a level of this. They spend part of their day at mom's house and part of their day at grandma's house. We've offered them these 4 things, and then we follow up with the department, whether it is Clear Core Detroit, or it's housing revitalization, or it's buildings and safety, or it's water and sewerage, to make sure that that child and their family have gotten access to everything they have. And we're building on this coalition. We're thinking about things like, how is it that we support families who may need legal aid, who have had a bad experience with a landlord because of this incident of elevated blood lead, or how is it that we can provide them potentially safe housing as they're getting their housing abated. And so this creates a platform onto which we can build to continue to improve case management. So we're thinking about what we do in the environment to remove lead, what do we do to make sure that every child who may have lead in their blood is identified, and what do we do to make sure that every child who is identified has access to all the resources that are available. This is just the beginning. The work of lead elimination is going to take many years because there's lead all over the environment. However, in places like Detroit, where the baseline prevalence is about 9%, there is nowhere more acute than here for us to start really thinking about how we take this problem head on. We tackle it by the horns, and we do what we need to do to eliminate the challenge. We really appreciate your partnership in that respect. I see a lot of familiar faces who are really partners in the work, and we look forward to more. The key question that I would ask us here, and I think I try and ask this whenever I'm among folks who care about public health, is how do you contribute to the solution? Right? What is your piece of the contribution to the solution? Because you hear about a place like Flint, and you hear about these terrible things that are happening, and folks say, well, I want to be a part of that. Well, you actually don't unless you have something to offer, right? There are many, many challenges that we face in the city, many, many public health challenges. And I think we have to be very honest with ourselves about being willing to solve those problems, whether sexy or not sexy, that we have an opportunity to solve, right? And so what I would say is, what is your piece of the solution? And if not, then there are many, many other problems that need solutions as well. But I appreciate the interest around this issue. I think we need more attention on it, and I'm glad that if there is any silver lining in the cloud, that it's that folks who are concerned about this issue. But we need to collectively come together and ask, what are the pieces to the pie, who's got those pieces, and how do we play them? I really appreciate the opportunity to be here today, and thank you for this and to the Cures Community Advisory Board. Thanks.